Let me just say this, and I know we don't have a long time here. I wish we had about an hour to just kind of go through this crazy period that you served in, but I just wanted to say, and I think this comes from a lot of other people, certainly those who know you and know your work, that how much it was been appreciated in the worst possible times where most people in the situations there are no winners. But just congratulations to that, and we wish you well in the future. But your thoughts now as far as kind of leaving this whole chaotic part of your life behind.
Yeah, well, first off, I have to say what an honor and privilege it was to serve during this time. I'm an infectious disease doc and have been in public health for a long time, and it's kind of like going to the big game, right? And so, proud to have been able to be a part of it. But I'd always planned to get back into clinical medicine. Going back to be a real doctor. I haven't been able to be a real doctor, and I'm too young to quit working. So, it's a good time to hand it off to new leadership.
Well, first of all, I don't understand how you escaped with the hair, still a full head of hair, and not too many gray hairs there. That doesn't make sense. So you've got good DNA.
Dude.
Let's put it this. No, I doubt very seriously if it's dyed. I think he's got
I'm
good
not
DNA.
dying, I have to say. No.
See there. When you look back on this, when there were so many things in this chaos, and I say chaos because not only you, but on a national basis, all the way up to the White House and the previous administration and this administration, sometimes it was a no-win situation because you're getting a lot of information in, and sometimes it's information that's contradicting. But speak to that and a little bit about your experiences through this pandemic.
It's been really surreal in a lot of ways, but I'll start off by saying that it was a really good working relationship with the governor. He was always open to hearing whatever, we needed to share with him and made a lot of time available to us. He was also, really thoughtful about what science was out there. And certainly that's one of the challenges is that we had a lot better perspective seeing day to day what was known, what was unknown, and what made sense. And trying to take a complex message in a constantly changing situation was extremely challenging. There's no doubt about it. But one of the biggest challenges was, I think, that maintaining trust with the communities. Maintaining trust with the population was really a challenge, especially because initially there was so much panic and anxiety, and then it transitioned into complacency in so many ways. Trying to maintain a safety message that sort of ran down the middle of what is reality without generating unnecessary anxiety, but also making sure people understood the real risks because there were real and legitimate risks, and we lost a lot of folks.
Yeah, and there's so many things that we didn't know. I mean, we're simply because we haven't gone through a pandemic in our lifetime, and it's been a long time as far as the country experiencing this. But at the early days, there were so many things that we didn't know. We didn't know how dangerous it was on surfaces or in the air, what we breathe, would a mask do any good, would it not do any good, and how do you navigate through that? Certainly in your position.
Yeah, it's tricky, but I think being steadfast and just saying what you know, what you don't know, trying to engender trust as much as you can, and it's sometimes it's hard to say what you don't know, and I think we saw that on a lot of levels, and especially with the World Health Organization early on, they made some pretty strong statements that they were sort of reluctant to step back on because they had said them. And I think that undermines public health messaging if we're not willing to say, because it was a new virus. It was a new thing.
Well, not only that, as far as the mutation, you never know what the next stage of that's going to be.
Yeah, exactly. And that's one of the things that coronavirus has really thrown us so many curveballs because it changed so rapidly, and the mutations change the characteristics. I mean, we think about, what happened with the initial strain versus what happened with Delta, which happened with Omicron. It's almost like having a whole new pandemic with a new virus.
Yeah. What do you think some of the hard, fast rules that you've learned at the end of this that haven't changed and we'll be probably living with for a long time now, whether like a new strain of flu? Can you speak to that?
Yeah, you bet. And I think we're probably transitioning away from what we consider, what I would consider necessarily like a broad public health response, right? We know a lot about the science. We know that we can prevent it. We have, good vaccines, and hopefully we'll be getting new versions that'll be more effective against, current and future strains. But also we have effective treatments. And that's one of the things I want folks to know is if COVID is still deadly, it's still killing folks. And if we see resurgences or people get COVID, they need to know to get diagnosed and treated. Kind of like one of our biggest successes during the Delta surge is, we were the #1 per capita user of monoclonal antibodies. And many hundreds of lives were saved through that effort. And we don't need to leave that behind. We need to make sure that our folks and our doctors and nurse practitioners and PAs are embracing the oral antivirals out there that are really good, especially the Paxlovid. It's like 90% effective. So that's fantastic. That's just like the monoclonals. So we don't need to forget about COVID. We just need to think about it in a different way.
Do you think we'll be able to take care of this with a pill in the future? I know that's the next thing up.
Yeah, I think so, and I think there'll be more things out there. The current oral medications are going to be for treatment, but we might have some, that we're going to use for prophylaxis. The current ones are kind of a little bit complicated, and there's some drug interactions that make it more difficult for older folks who are on a bunch of meds. But I think so. This is becoming more of a scientific medical response.
I wish we had more time. Dr. Thomas Dobbs, thank you, sir. And again, salute to you and to your tremendous service. We appreciate it.
Yeah, thank you again so much for having me.